I would like to turn to you, Victor. You have been consistently raising the importance of reducing inequalities in access to care across Europe, and the need for the EU to support member states. Based on what we've just heard from the audience and on your work in this area, what do you see as the key action that Europe should prioritize?
So first of all, thank you for the invitation, and thank you for your work in talking more about this issue at European level. And of course, your report will be, I think, really important when it comes to influencing EU decision-making in this field. So I'm happy to be here with all of you today. As one of the previous speakers said, unfortunately, we have limited time. At the end of the year, everyone wants to organize events. But I wanted to be here because for me, cardiovascular diseases, it's a personal issue. Unfortunately, I lost my mom because of cardiovascular disease. And I saw all the things that were mentioned by my colleagues here. The problems related to prevention, the problems related to getting access to treatment, the inequalities existing across Europe, the difficulties in dealing with a heart attack, in waiting for the ambulance, in taking care of a patient afterwards. I saw all of that. My mom had the opportunity to live in Romania, where unfortunately we have one of the highest rates of people dying because of cardiovascular diseases, but she also lived in Belgium and France. And we saw the differences in terms of medical treatment, in terms of equipment, but we also noticed that every time we were going to meet a doctor, we received other recommendations for treatment, which I don't know if this is supposed to happen, but this shows that there is not enough coordination. And unfortunately, we also noticed how difficult it was to take some data from one country to another. We had, you know, a file with all the papers that we were moving from one doctor to another. This is real life, colleagues. You are the experts. We should tell the Commission to act because those are the things that can be corrected at European level. We can have proper funding. We can invest in research. We can coordinate better instead of having national or regional clusters when it comes to innovation. We can work with the private sector. We can work with the patients' organizations. We can help data move faster between our hospitals and, of course, between the people that collect data and do research. We can have common use standards. We can have all of that. We can have a regulation. I don't know who in the Parliament, and hopefully in the Council, could say no to all of those things. I don't know. So there is no reason why not to move forward. So I have high hopes when it comes to what the Commission will present today, but at the same time I can underline that we in the Parliament, we also know the things that can be improved. So please do count on us in trying to reinforce these important strategies that we hope to have at European level. And as some of my colleagues said, in making sure things are implemented, not only written on paper, because again, for many of the people concerned, this is a personal issue, so we have to make sure this is also happening in real life. Thank you so much.
Thank you.